A lot of people will also have issues with their peroneals, and the peroneals are on the lateral compartment of the lower leg. They deal with a lot of stability. You can see peroneus longus, brevis, and tertius. And one of the things I find interesting is the peroneus longus is the fibularis longus. They changed the name recently. Fibularis longus, that the blue and the red, those are the same muscle. But peroneus longus or fibularis longus is the big guy. Do you see how it wraps down around the ankle?
Yes.
Yeah, so it's like people can have weird pain like on the outside of their foot or like the underside coming from these muscles. And part of the challenge for like a massage therapist is because these muscles are in a lateral compartment, if the person is on their back or on their front, they have to come in from the side, which is like a weird space to deliver pressure. The way that I have people work on this is, again, with our old trusty tennis ball. And because it's in a lateral compartment, what I do is just like before we were in the front, we were in the tibialis anterior. Now I want to come in a little more lateral.
Okay.
And what I'm going to do is I'm going to bring my leg to the side. And what I'm doing is I'm stacking my leg over that tennis ball so that, again, holy moly, so I can lean right in. I'm going to change the angle again so you can see this. So I can lean right in. I can press on the tibia right here at the calcaneus, right at my ankle bone, and I can press on the thigh to try to press it down. And I get this crazy referred pain right on the outside of my foot. Kind of just, it's not really in the foot. It's more like in between the ankle bone on the outside and the foot itself, like this little phantom kind of thing.
Does this look like the right area?
How's it feel?
I'm trying to see. Does this look like the right area here?
So here's what I want you to do initially. I want you to go higher, which is I want you to go up a little bit closer towards the knee. There's no reason you can't work down here as well. You can see where that tennis ball is, but you don't have as much tissue right here. If I go higher, this is real fleshy. This is fibularis longus. I'll show that again here in just a second. Because you can see that big red on the right side, the fibularis longus. That guy is the one I'm trying to get to, that big thick section. That's the safer spot to be able to press in. So I'm up here and I'm going to try to put the tennis ball into that.
Okay, I found it. I think.
Yeah.
It's that pain I talked about at my ankle. I guess the other side, like this here.
Yeah.
I feel that extremely tensely.
So I get this thing, it like wraps around the outside of my ankle bone. Like I'm getting this referred pain that refers right around the outside. Now I can kind of push that way. I can pull in. I can move different directions. I can also move down the leg or up towards the knee. So long as I'm not pressing directly on bone, soft tissue is what I'm trying to address. So anything along this lateral compartment, I can press in relatively safely. Again, it's that thing about pain. It can be intense, but my body isn't telling me to like contract muscles to protect myself.
Does moving my foot up and down help in this case as well?
So in my case, and this is me, I find athletes really like this, but I get more benefit if I come in and find that spot, and that's lateral. Oh, okay. Oh, okay. Then what I do is I can press in, but I'm going to take my foot, and hopefully you can see that.
Yeah.
Oh, and I start, so it's like I plantar flex, I dorsiflex. I'm like moving it around because I'm trying to get a sense of like the movement that muscle causes to be able to lengthen and shorten it.
Okay.
And work through it actively. I find that I get more nuance, more specificity by doing that through the peroneals.
Okay. Yeah, if I get up here, kind of like there.
Yep.
I can feel, sometimes I wonder if I need to be careful of if there any nerves there, but you're saying, is there any way to tell if I am hitting a nerve or something like that?
So here's what people will feel. And for other people, this is kind of freaky. Okay. They'll feel numbness and tingling.
Okay.
Usually in the order of like you press on something, you feel tingles, then you feel numb. For some people, that kind of freaks them out. For me, that's another day at work.
Okay,
like,
so I don't need to worry
about that. Happens all the time. The thing that I want to avoid is pain. Okay. And I don't mean intensity, because I've had intensity, like pain is right here, intensity is right here, and I've had and I breathe into it, and it's like, no, we're fine right here. And for some reason, that's what feels most engaged in my nervous system. That also seems to be what helps me release and let something go more rapidly. It's also why the sessions I perform seem, in my opinion, and experience, to be able to help people out of pain more rapidly. The people are coming in for a soft tissue treatment for pain management. They're not really coming in for a massage. Does it make sense?
Yeah, definitely.
Yeah. Like I've got a drummer coming in later this week, and he's describing some shoulder thing, and I'm like, I think it's your anterior scalene.
Yeah, probably.
And I'll see when I work on him, and I should be able to film the session. But you start to recognize these pain patterns. So for instance, when you told me what you were dealing with, that's how I knew what anatomy to grab. Because I'm like, yeah, he's probably just having some sort of issue with the muscles around the lower leg that's influencing what's going on with the foot.
Mm-hmm. Great. Yeah. This is, so that's the whole, I forgot what you would call this side of the leg.
Peroneal.
This side, but I guess there's this here.
That lateral side.
Lateral, yeah.
Yeah, that lateral side. The peroneals. It was peroneus longus, peroneus tertius, and peroneus brevis. But they changed peroneus longus for whatever reason to fibularis longus. But those lateral compartment muscles, I see a lot of massage therapists skip those. And it's because it's on the side. So the best position for a therapist working on it is in sideline, which is kind of difficult for some therapists to drape. So.
Okay, yeah. Great.